welcome to Module 2 of our Breast MRI series. On completion of this module, you will be able to list the indications and uses for breast MRI and understand the significant role of MRI in the screening and prognosis of breast cancer and its treatment. Breast MRI is an indispensable modality along with mammography and ultrasound. Its main indications are screening of high-risk patients, lesion characterization, evaluating the extent of breast cancer, pre-surgical planning, assessment of chemotherapy treatment response, MRI-guided biopsy, clarification of false positive results, breast augmentation inspection, screening of patients with dense breasts at a younger age. High-risk patients are people with a personal history of or genetic predisposition to breast cancer, such as a family history of breast cancer or testing positive for a cancerous gene. Sonograms and mammograms used to be the only tools used for routine screening of high-risk patients. Studies show that over the years, introducing MRI in routine screening has improved the detection of breast cancer in these patients. MRI is also recommended when mammograms and ultrasounds detect suspicious lesions that may generally have a benign or normal appearance, but present some clinical signs and symptoms of malignancy, like bloody nipple discharge or swelling and redness in the breasts. Contrast-enhanced MRI helps characterize suspicious lesions through the increased contrast in wash-in, wash-out rates. After the detection of breast cancer in a mammogram or breast ultrasound, MRI is useful in determining the extent of invasive ductal carcinomas and detection of multiple lesions and presence of lesions in the contralateral breast. MRI determines disease extent more accurately than mammography and physical examination in patients. The extent of the disease is evaluated through detection of multifocality and multicentricity. Invasiveness is assessed by looking at the deep fascia, which includes the pectoralis muscle and intercostal muscles. MRI evaluation of breast carcinoma may be useful in identifying the proper surgery required for each patient according to the resultant diagnosis, characterization, and evaluation of the extension and invasion of the breast lesion. Surgical procedures may be lumpectomy, mastectomy, breast conservation, or others, according to the relationship of the tumor to the muscular fascia. Breast cancer patients often undergo several MRI screenings before, during, and after chemotherapy sessions to compare tumor size and extent as treatment progresses. Comparing the results of these scans shows how well the patient is responding to treatment and helps with tailoring the treatment plan process. Localized tissue markers are placed before the beginning of treatment to preserve the location of the tumor in the event of a complete response. In some cases, patients who have had partial or total mastectomy undergo an MRI scan to search for any residual extension in the remaining tissue or deep fascia, as well as reoccurrence of new lesions. MRI is indicated for guidance of interventional procedures such as vacuum-assisted biopsy and for preoperative wire localizations for lesions that are occult on mammography or sonography and evident only with MRI. At times, imaging and biopsy results may differ from the same patient. One could show a malignant result while the other comes back benign or inconclusive. MRI would be recommended as a follow-up to clarify results and determine a final diagnosis. MRI is an essential indication for patients with breast augmentation. Routine inspection of breast augmentation is necessary in maintaining different kinds of implants and injections, such as silicone and saline implants. Mammograms are a bit difficult in these cases for fear of damaging the implants or causing discomfort for patients, which is why MRI is the best and safest screening tool in these cases. More importantly, MRI is essential in cases where patients have undergone implant reconstruction following a lumpectomy or mastectomy. These patients may benefit from MRI screening for reoccurrence or residual extension of breast cancer as well. Younger women under the age of 40 are not candidates for mammograms for two reasons. One being that it is better to avoid radiation in this area at a younger age, and the other being the density of the breast in this age range. Some women above 40 have dense breasts as well. The tissue of dense breasts may be obscure on a mammography, which is why MRI is recommended for better and more accurate screening. Now let's discuss breast cancer and MRI. There are many indications for breast MRI in the breast cancer journey of patients. They can be categorized into two main groups. First is during the screening stage. Screening could be of high-risk patients needing routine MRI to check for suspicious lesions, or patients with a history of breast cancer needing MRI to check for recurrent lesions. Sometimes MRI is done after surgery or treatment to check for residual malignant tissue. Second is during the treatment stage. MRI before treatment is used for surgical planning after assessing the size of the tumor, the extent of it in the breast tissue, and its level of invasion into the pectoralis and intercostal muscles. MRI can also be done before, during, and after chemotherapy to compare the size and extent of the tumor to assess treatment plan's response so the treatment plan process can be properly evaluated. A localizer may be placed to the mark location of the tumor before the beginning of chemotherapy in case complete response to the treatment is achieved. Finally, let's summarize what we have learned. Indications for breast MRI are as follows: screening of high-risk patients and patients with a history of breast cancer, implant inspection and assessing the well-being of augmented breasts, assess and treatment response by comparing changes in size and extent of the disease on different MR results as treatment progresses, planning surgical procedures according to the type, size, and extent of different lesion types. MRI is more sensitive than mammography in younger patients and those with denser breasts. MRI guided biopsy in cases of lesions that can only be seen in MRI, clarifying inconclusive breast imaging and breast biopsy results that do not correlate with clinical signs and symptoms of patients. Determining the extent of the disease in the breast tissue and level of invasion into the deep muscles and lymph nodes. Characterizing different breast lesions according to their appearance and enhancement.